Hi, Victoria here. Thank you for joining me again. Today you are going to see Mirka have a beautiful core therapy treatment. Now this one treatment is going to be split into 3 parts. First of all, in today's video you're going to see the kinesiology, muscle testing, and the start of her actual treatment where I do some qigong, some repatterning, and I talk you through exactly what I'm doing and how it helps. So thank you for subscribing. Please do like, comment, share, and watch next week to see an Anmofu abdominal massage. So Mirka,
Hi.
hi. You have had one core treatment already,
Indeed.
and you're back for more.
Yes, please.
So how are you feeling today?
So after the last core treatment, I felt a lot better. After the treatment, I could not believe how aligned, how balanced I felt. That might have been first time ever. Today, feeling a bit stressed after being at work. So good luck.
Okay. Okay. So when you say you felt better, it's because you felt aligned. So is that when you're walking and
Kind of more felt as in body and mind aligned rather than physically.
okay?
Physically too, especially the ankle which was broken.
Yes.
Um,
So you had a broken ankle.
Left ankle, yes.
Yes.
Yeah.
And that was this year, wasn't it? So it's very recent.
Yes.
Yeah. Okay.
So just after the first treatment, I was already a bit better.
Wonderful.
Went for 2-hour walk yesterday, so a bit sore after the walk today.
Okay.
But it's definitely less than it would have been without the treatment.
Okay. All right.
But yeah, the biggest difference felt in just general well-being rather than just physical.
Okay. Yeah. Nice. I like the way you describe it.
Good.
Lovely. So let's see what we can achieve today.
Mm-hmm.
Okay. I look forward to treating you. So here we are in the bothy. The first thing I do with all clients with a core therapy treatment is test for a strong indicator muscle, an SIM. So I'm testing each limb in turn, asking Mirka to resist as I push down. I'm just getting an idea of Mirka's strength. Meanwhile, she gets an idea of how much pressure I'm going to be applying to each of her muscles. Having found a couple of SIMs, I continue by testing her IPSI, which means a one-sided test to see if both one side of arm and leg can move forward with strength at the same time. I find a weakness on her right side, so I'm currently anchoring the sacroiliac joint at the back of her lower back. I retest that weakness that showed that to me, and it went strong after I had therapy localized it. I explain what I'm doing to her as I'm going along. And now I move on to a contralateral test. As you can see, it's across the body. I'm not too happy with these, especially that right arm and shoulder shows quite a lot of weakness. So I'm using her left arm as an SIM, a strong indicator muscle, in order to find out where any weakness lies by touching the 6 different joints of the contralateral test that had failed. I'm using her left arm as a test to see what's passing and failing. I'm constantly updating my notes because there's so many tests that I don't necessarily remember them all as I'm going along, and I want to make sure I don't forget any areas that do come up as a weakness. every area needs to be part of the treatment at the end. Now I'm looking at something called an ASIS, which is the way that our hips lie. Whether they're twisted, that means torsion, whether they are coming forward or aligned backward, anteriorly or laterally. Having done the hip test, I'm now looking at this one called a psoas test, which checks to see whether actually her neck and her mid-back, the lower thoracics, are aligned and working correctly. So this is called a ballet test. As you can see, it's like a pirouette stance, and what core therapists do this for is to see whether each hip is happy opening. So I'm looking at the moment at her right hip to see whether it's happy opening to a small, medium or larger effect. And I'm really happy with those compared to the first treatment that she had the previous week. They were very strong. That's a really good sign for her. It shows it's good not only for her hips but also her lower back. They'd been quite weak the previous week. So to a small, now a medium on her left hip. Now a larger effect. That's really good. And I say there that I was putting quite a lot of pressure on, so that just shows how strong she is there. This is a series of tests now called a pitch, roll and yaw. The pitch tests to see with her head up whether she's able to pull herself out of a chair or start movement forwards when she's walking. The roll, which she's doing now, gets to see whether her shoulder and opposite hip are happy when they're rolling inwards during the different parts of walking. Now I'm testing her yaw, which is the opening of a shoulder and opposite hip, while the other two are rolling inwards. It's interesting, those three phrases, pitch, roll and yaw, do come up frequently with sailing and with piloting a plane. They're all the different movements that the body can do. I just tested then a lat dorsi test. The latissimus dorsi is the large muscle across the back, and I noticed that there was some tightness on one side, which actually shows us T6 is very tight and, like we say, congested. It's blocked for some reason, so I will be looking at that when I'm treating with the tuina. Then I'm testing now a quadriceps test. Now the quads are the very strong muscles in the front of the thighs, and I'm explaining to Mirka here that if both are weak, which they were, then it actually shows that the parietals are not in a good place to be able to support that quadricep function. So I'll be looking at that at the end of the treatment during the cranial balancing. Here we're testing the piriformis, and both come up really strong, which is excellent. And again, that shows really good pelvic muscle alignment. Great. Now working on the TFL, the tensor fascia lata muscles, which are on the sides of the thighs. Again, it's a big, strong muscle. I'm just asking Mirka the direction I'm going to be pushing in, applying a little bit of pressure and seeing whether there's any strength there. No, there's some movement, so I'm not happy with that. I anchor it in order to tell the body it needs to get on with helping Mirka out there. Trying this one as well. No, there's too much movement. So both, it's a bilateral muscle weakness. This is an action, a very strong up and down rubbing action on the TFLs in order to encourage clearing toxins and awakening the muscle and the stimulation for the nervous system to get on with stimulating a strong response to the test. Still not working on that side. Come round, test the left. Still not working, it's too weak. So I'm going to try something else, which is called an origin and insertion technique. Now, every muscle has a start and an end, a head and a foot, and on those starts and ends there are little barbs, like little catches, which is, if you like, similar to Velcro. They're little hooks that latch onto the bone, and sometimes they can slightly get detached, and they just need to be firmly, as I'm doing now at the start and the end, pushed back on, as if you're reattaching the sellotape, the Velcro, back onto the muscle. And that worked really well. That's what she needed on her right hand side. So I'm testing again on the left, really firmly. Now this can be a little bit painful if there has been weakness there, for instance the broken ankle earlier this year. So I'm pushing nice and firmly for a minimum of 20 seconds, and then I retest that TFL muscle action, and that's really good. Really pleased with that. That's worked instantly. And now I'm explaining to her that the other reason we can have a bilateral TFL muscle weakness is actually an iron deficiency, which, yes, can be anemia, but even if it's a weakness, not necessarily a strong TFL weakness producing iron deficiency, but just even to a minimal effect, then we need to be bringing more iron into our diets. So, for instance, a handful of nuts and a handful of mixed seeds every day. Now I'm moving on to the abdominal tests. I'm asking Mirka to therapy localize them herself. So I'm showing her exactly where to touch. This one is the ICV, which is called the iliosacral valve. And I'm seeing whether it's open or closed, or twisted one way, clockwise, or twisted the other way, anti-clockwise. I could see that there was weakness there at the start of simply Mirka therapy localizing the ICV, so I continue by going into a little bit more detail, finding out exactly where the issue lies, and that has the effect at this stage of informing Mirka's brain that there is some weakness there, and the brain will know exactly what it is because of my detailed test, and we'll get on with trying to sort it out, especially because I'm going to be, after this, giving Mirka a deep abdominal massage called a Chinese Anmofu. So here I am testing all of the organs in turn. After the ICV, I tested the liver, the gallbladder, a point called the AP, the anxiety point, and Mirka had come with some stress today after a stressful day at work. Then I test the stomach, the spleen. Right now this is a place called the Ren, a Chinese key point called the conception vessel. Just there. And now I'm going to test with my hands on the kidneys and the adrenal glands. So there were a few weaknesses there which I'm not happy to leave as they are. So I've told Mirka that in a little while I will be giving her an Anmofu beautiful massage, and that will help in so many more ways than just the abdomen. Continuing now with a few more tests now she's turned over. This is a gluteus maximus test, i.e. in the buttock, doing each in turn. Again, I wasn't completely happy with that, and it should be a really strong muscle of the body, the glute max, but very commonly most of us have an issue with our necks, and that affects giving the glute max weakness. See, most of us here should be able to raise that knee quite a high way off the couch. It is up a little way, but I'm still not happy with that, so I will be giving Mirka a neck release towards the end of the treatment. Just having a little feel of her back at about lumbar 3. I'm asking her to hold together her little finger and thumb in order to test the different points, as I call them, the north, east, south and west of her sacrum. A couple of them were strong, but a couple were weak. So even though in the other test her ASIS proved nice and strong, her ballet was much better than the previous treatment the previous week, but her sacrum is still a little bit tilted, so I will definitely be giving Mirka a sacral float that you will see in this treatment, and also this treatment now, which is tuina, a Chinese massage. As you can see, it really focuses on rocking. I'm using the base of both hands, one as a stabilizing effect, one doing most of the rocking technique, on her spine, pushing the spine from one direction towards the other, and occasionally pushing directly down to see if there is any movement, which there should be, from one vertebra to another. If I feel any area is stagnant or fixated or subluxated, then I will focus on that area a little more, but that actually means coming away from the area at first and making sure that the spine either side of any tightness is looser before I come to the area that was fixated. Fixated means where two or more vertebrae are stuck together and move as one, and subluxated means one vertebra or more might be slightly left or right of its normal range of movement. This is a beautiful rocking technique. It is so nice to receive. It almost takes you back to the cradle, that lovely feeling of being nurtured and cared for. This is such a caring treatment, and I like to call it a listening treatment. We're always looking for even more signs and messages from the body to us, to ask it to inform us where needs more attention, where needs more help and care. So I'm also looking for any cool or heat. I'm looking for areas that don't move beautifully when I'm rocking, moving, and nurturing with that tuina technique. The shoulders should move independently. The scapula, each shoulder blade, should move in an isolated way, not as one with the spine, not as one with the whole shoulder top. And already you may notice that Mirka's spine is moving better. It's moving more like a wave action, not only on the spine itself, but right down into the pelvis, the sacrum, even down into the legs. Now I'm with my base of my hands, my thenas, I'm doing that lovely drunken walk down each side of her upper back. This isn't on the neck, this is between and on her thoracic spine, down over the trapezius muscle, each side of the erector spinae muscle, which travels down each side of the spine. And by now Mirka will be deeply relaxed, almost like she's being cajoled and coaxed into relaxing and letting go. While I'm supporting one foot and ankle with one knee, I'm again always feeling and seeing as well as treating. Deep down into the foot, I'm checking, because I'm looking in the distance here, because I'm feeling with my hands what's going on inside her foot, which also means what's going on inside her whole body. This is a leg repatterning. It actually works by levering the opposite hip up from the couch. So it uses that leg on the opposite hip as a lever to reset, repattern, realign the pelvis. Now working on Mirka's right foot, always trying to separate the ball of the foot from the rest of that upper bone and muscular area of the upper foot. And by doing that, it actually helps relieve any tightness of the same-sided scapula from the tightness of the upper back. I'm working quite low down to the floor, but also low down in terms of her lower leg, not coming up beyond her knee line. Beautiful. It feels so nice to receive, although I know it does look a little odd. Now this is a treatment you may not have seen before called a sacral fix. It helps to fix any imbalance in the alignment that I'm looking at now on her sacrum and lower back, also into her lumbar. And I'm using her legs very gently in the manner that the legs want to go, to rebalance, realign that level of her lower back. Now coming up to two hands overlapping, fingers pointed upwards towards the head. Nice light pressure on the lower back, where I've got my lower hand thenar muscles, the base of the hand, almost over her coccyx, the very base of the sacrum. And both hands are now feeling into the sacrum. I'm working out whether it feels stuck, which means stagnated, no movement within it, not even with Mirka's breath. I'm feeling whether there's any heat or cold there. I'm also feeling into the energy. What is Mirka's energy through her sacrum telling me? I close my eyes and I tune into her breath, but also the pulse of her cerebral spinal fluid. Now, through research, it has been shown that our cerebral spinal fluid actually pulses at around 5 to 10 times every minute. Now, that could be once every 6 seconds or so. So it's not at the same time as our breath necessarily. It's at a different pace. And as it pulses, works its way down the spine, circles around S2, sacral 2, and then back up again, it tilts the pelvis naturally up and down like a little pivot. And as I feel into that, I try and correct any imbalance, any lack of consistency. I slowly bring Mirka around, ask her to gently turn over. And once she's settled, I tune into and look at her pelvis. Now she's lying on her back, feeling into the bones, the tibia and fibulas of her lower legs to see if they are warm and loose, feeling into the feet. I've got my thumbs under each foot, into the neck, which is the base of both big toes. I'm always looking at the body to see where any imbalance may lie. So join me next week where I continue Mirka's treatment with a Anmofu abdominal massage. Thanks for subscribing, guys. Hi guys, Victoria here. Welcome back. Please subscribe if you haven't already. And today you get to see Mirka's second stage of her core therapy treatment. So this is something you haven't seen before. It's called an Anmofu, a deep abdominal massage. This helps with lots of different issues, as I explain when I'm talking about it through the video. And watch to the end to see whether her muscle tests say that her body is better functioning and the nervous system is more connected and working better. So you'll see whether the Anmofu has worked for her or not, and in what respect, and I explain everything as we go along. So please subscribe, like, comment, share, and watch next week when the therapy continues for a cranial balancing core therapy treatment. Okay, see you soon. So here we are continuing Mirka's beautiful core therapy treatment. The first thing I do in this particular edition is I'm checking with kinesiology, which means muscle testing while I'm testing her right leg. I'm testing various essential oils while she holds them on her ICV, which is the iliosacral valve. This is a way of working out whether her system, her body, can tolerate, and in fact which essential oil would be the best one for her. I've selected 3 essential oils, which are corn mint, clove oil and cardamom, and all 3, as it happens, are very good systemically for the digestive system, and this is the area I am focusing on today. I did actually test quite a few oils, maybe 10, 12 oils, including lavender, eucalyptus, black pepper. But in fact, the three that came up, the 3 C's, all are very good for things like headache. They're very good for the digestive system and stress. They are particularly good for treating inflammation, so they're anti-inflammatory. Yes, for digestively, but also, as I call it, inflammation of the brain. This is when we have stress, we have neck tension, potentially headaches, sleep disruption. And so all of these oils, our body just knows which one is needed, and her strong muscle test revealed to me those particular 3 oils. A lovely mix. Again, not necessarily a mix I generally choose those particular 3 oils to put together, but they're beautiful in this occasion. So this is an Anmofu deep abdominal Chinese massage, which is part of TCM, traditional Chinese medicine. And you can see here that I'm using my fingers at this stage. Sometimes I use my palm, sometimes my whole hand. And this is clearing away from the tummy button. And on this area where I am now, I'm just over the ICV, the iliosacral valve, and Mirka's finding that area a little sensitive, so I'm lightening my touch. I'm starting off quite gently anyway, but I invite her to raise her knees in order to take the pressure off her abdomen while I'm massaging it. So once I've cleared away from the tummy button outwards, I then clear underneath the ribs, so over the liver and over the stomach to the spleen. And now I'm overlapping thumbs in a reverse direction on the colon. But then once I've reversed it, I then use my whole hands to encourage movement and flow, the peristalsis movement, in the correct direction, like this. So at first, as you can see, it's overlapping fingers in the reverse direction. If you imagine a long pipe, and imagine that pipe was blocked, filled with soil or whatever material, and if you wanted that long pipe to shift its soil, you wouldn't just push from one end. You try and agitate that soil first of all in order to break it up, to maybe move it back to an area where there was space, like ether, a void. And then you would encourage movement in the correct direction in order to encourage flow. So that's what that particular movement was doing. So you may notice that I'm doing a new movement now, which is generally in the direction of a clockwise manner, as you can see, but actually each of my smaller movements were anti-clockwise. Then a little bit of cupping of my hands, and now back to that very first technique again, which is clearing away all the way to the sides of the abdomen from the tummy button. So this is actually in 8 directions. So this is, if you like, north, south, east and west, and then I encourage the clearing of that energy in between the north, south, east, west, which makes sure that any congestion and ether and gases, any toxins will be encouraged to move. And once they're moving, i.e. not stuck in one area, then they will find their way out. They will find their way over to the lymph, to lymph nodes, which will encourage movement out through our waist system. And that will make us feel better. Once there is movement, as the Chinese call, we don't want stagnation in the body. So movement or flow, for instance, blood flow and abdominal flow, will always be a good thing. That's always what we want in our lives. That's why it's so good to practice yoga, tai chi, movement, stretching, Pilates, all of these lovely stretching, relaxing, movement, flow exercises. So again, I'm back to the technique to encourage the colon, which is found on the two sides of our abdomen and across the top. And now back to the clockwise direction, and yet my fingers are in a small way moving anti-clockwise. And this action, because I'm actually working quite deeply, just to agitate, shift, move, to encourage health and vitality. And what can happen after one of these treatments is people might feel quite different. They'll feel like they've had quite a profound, deep healing treatment. It can affect them that they need to visit the bathroom. They may feel very thirsty, that they want to encourage more waste disposal. And it can happen that sometimes, just like after any healing therapy, they may get a small headache because any toxins that may have been stagnated in the body, once they're moving, it can affect that headache kind of feeling, like a fuzzy, blocked feeling in the head. But most of the time, most people will feel amazing. They'll feel anew, like this has been ready and waiting for such a long time. This is right under the ribs here. I'm getting my tips of my fingers almost under that rib. And each time I repeat the series of techniques, which is actually a repeat of 3, and I'm on the 3rd of the series now. Each time, again, it's like a listening massage. I'm listening with my hands to see how it feels compared to the first and second repeat. And every time I do this, without fail, I notice that the abdomen, in fact the whole body, feels softer. There is softness introduced into the abdomen. Each of the organs feels better. I'm always sensitive to areas that feel tight, and in fact, instead of focusing on that area, I'll come away from it, work somewhere else, come back to it, see if it feels better. If not, come away from it again. And this softness in areas away from any tightness will always have an effect back to the tight area, the area of stagnation. Back to that lovely cupping. Again, all of these techniques is encouraging movement of any gases and airs, any waste, in order that we expel nicely and comfortably. So just using the tissue now, because I did actually introduce quite a lot of carrier oil, which was holding the essential oils, onto the abdomen, and that's on purpose in order to encourage a release of toxins through the skin from the abdomen into the oil. And that's why I endeavour to soak up all of that carrier oil, all of those toxins, and to put them away in the bin. And now I invite Mirka to lengthen again. I'm going to test her for the areas that weren't happy earlier. First of all, I'm going to ask her to take 3 deep breaths, and I'm just feeling into her iliosacral valve. First of all, I'm just sensing how it feels, whether it feels better than earlier, and it does. It feels much softer, although Mirka is quite sensitive here. There might be something going on where she might need more than one treatment on this area over the coming weeks. And once she's done 3 deep breaths, I then clear the ICV in the correct direction. And now I'm massaging that area, always talking to her, seeing how she feels, making sure that all is well. And now I'm educating her so that at home she can continue that kind of massage on her own. It's really important for us to take on board some homework, some independence with our bodies, and help ourselves in between treatments. And now I'm retesting the areas that weren't happy earlier. So that was the ICV, the liver, we're now doing the gallbladder. Up to the AP, the anxiety point. This is to do with her stress level. She's got quite a stressful job. That wasn't happy, that still failed unfortunately, so I will be definitely working more with any anxiety. Now this is the stomach, and then onto the side with the spleen. And then over to the other valve called the Houston valve, and make sure she's holding in the correct place. And now to the Chinese point called a conception vessel called Ren. That felt better. And now I'm just testing her kidneys. And finally her adrenal glands. They all feel better. So I'm just letting her know now that a couple of them still weren't completely 100% happy. Better than earlier, so that was the ICV, the AP, the anxiety point, and the Houston valve. I've shown Mirka how to massage them herself so that she can help herself. So please do join me next week to see Mirka's cranial balancing massage, all the techniques of core therapy. Thank you for subscribing. Please do like, comment, share. See you next week. Hi guys, Victoria here. Welcome back to the 3rd of 3 parts of Mirka's core therapy treatment. In part 1, you saw the kinesiology muscle testing plus the repatterning of her spine, etc. Then in part 2, you saw the Anmofu deep abdominal Chinese massage, which is so healing. And today in part 3, you get to see the finale, the cranial balancing, techniques that you may not have seen before. I used some with Hannah in another core therapy treatment that you will have seen on this channel. But today they're slightly different techniques, and they're more aligned to stress relief and to make sure that everything is working perfectly so that she can function to the best of her ability, physically, mentally, emotionally and spiritually. Okay, thanks for subscribing. So welcome back guys, this is the 3rd of the 3 parts of Mirka's treatment. Having carried out the kinesiology muscle tests and a little repatterning, tuina and sacral float in the first edition, the second stage showed you the deep abdominal Anmofu massage to help clear the gut, which also clears the mind, really good for stress. And now I'm sitting at the head of the couch and I'm starting to get an idea of where any tension and stress lies, physical and mental, within the neck, the scalp, the cranium. The first thing I do after I've had a little feel for what's happening is I introduce a line of upturned fingers from both hands into the area immediately under the occiput bone at the very head of the spine. Now it's interesting, the spine doesn't stop at the base of the neck. The neck is part of the spine, and in fact when you look at a skeleton you notice that the top of the vertebrae, which is the atlas and axis, two vertebrae, reach all the way up halfway into the back or inside our heads. And that's how it manages to support our head, not by holding it underneath, but actually holding it within. So you can see how our necks can feel very tight. All the muscles, the sternocleidomastoid, the erector spinae, can feel very tight from the weight of our heads and our bones, our brains, our craniums. So to have a neck release done for you, where you release all of your muscles and trust and give in to the therapist, is one of the most releasing, cathartic feelings that you can achieve, in my mind. So having done 2 or 3 neck releases to the back while her head was aligned at the front, I now turn her head gently and I'm looking and feeling with my thumbs and my fingers how the 7 bones of the cervical vertebra, the top 7 vertebra of the spine, which hold the neck, I'm feeling for whether they feel in line with each other, whether they feel soft, whether they're malleable, so that the strong muscles and discs are able to move slightly left and right, if only a fraction. That tells me that the health of the neck is good, that it can support good brain function, nervous function, that the blood flow to the neck and head is good. This action where I push on the top of the deltoid is to see whether the arm bounces back, and you can see that's a really good bounce back there. I turn the head a little more, do the same again, and yes, that's a really good bounce back. That shows that the shoulder has loosened during the treatment, but also, most importantly, that Mirka is trusting me, that her body, even her subconscious, is able to let go, to release to the couch, release to the core therapy treatment, and allow the treatment to have an effect. I'm testing the other shoulder here to look for that important bounce back. Again, it's good there. And now I'm doing a really good long and strong stretch, pushing the shoulder down while my other hand is holding firmly under the occiput bone, which is the very base of the back of the head. Using both hands now with thumbs and fingers, massaging the muscles either side of the vertebra. And another neck stretch. You can see my fingers there are deep into the joint between the occiput bone and the top of the neck. This is so lovely to receive. What I'm aiming here is for the head just to tilt back, sometimes slightly, and sometimes it will tilt back quite a long way, almost as if the person is looking at the back wall. So yeah, this feels really good here, right into the neck, the base of the cranium, massaging the muscles. Now I've moved on to the next part of the treatment, which is qigong. Qigong is a beautiful, healing, deep energy treatment. It uses the healing mechanism of the person's own system to be stimulated and onward carry on the healing treatment far beyond while Mirka's on the couch. So I've got my fingers and palms underneath her neck, the top of the neck into the cranium. My thumb has now come round to the sides of the temporals. So this is a treatment where I'm tuning into the length of her vertebra. I'm picturing and feeling into the energy of what each vertebra is doing, one by one, starting at the very top, working through the 7 cervical vertebra, the 12 thoracic, the 5 lumbar, the 5 fixed sacral vertebra, and finally the vertebra that make up the coccyx, which can vary. Apparently it can be between 2 and 5 mini fixed vertebra within the coccyx. And as in my mind's eye and my fingers, I'm feeling and tuning into whether each vertebra is movable and aligned. If I get stuck at one, I will simply tune my energy into that area and ensure there is warmth and movement before I then continue down the spine. By now, Mirka will be deeply relaxed. Most people see beautiful colours of the rainbow behind their closed eyelids at this stage. Those colours can happen at any stage during a treatment, but most people will see them during cranial work. Because of a little stress in Mirka's life, I'm now making sure that I focus on that area, but also because it came up during her abdominal massage, because of the AP, the anxiety point, was not quite functioning. This is a beautiful, relaxing technique with qigong, which is the frontal float. The frontal bone is our forehead bone. I've also got my hand directly underneath her head rather than her neck. And I'm feeling into the energy between my hands. And although it looks like I'm moving or have moved her head over to one side, in fact, what has happened here is her head will move in the direction it needs to. You know that when we're asleep, when we are resting at night and we first get into a comfortable position, if you're lying on your back, notice how your head tends to turn to one location. Not often we're happy in the center. Because of the weight of our head, we often want to turn left or right. And maybe notice what you do next time. Maybe you have a preferred place. And for Mirka at the moment, it's to her left. I'm not pulling her head at all here. What I'm doing is allowing her time to move in any direction she wants to move. Her head has wanted to come up to a central location again. Sometimes people will move more quickly than this. Sometimes they just go to one place and stay. Sometimes they'll move left and right, and maybe stay in each location for a minute or two. Mirka's intention here, I can feel it through my hands, is wanting to come slightly more left again. I'm not holding strongly at all. This is a very light touch. Obviously her head is quite heavy on my right hand, but my left is holding very lightly. The energy, the colours are absolutely beautiful at this stage. Most people will see colours of purple and green, which tunes into the third eye chakra and the heart chakra. Quite often these will be seen together because healing and therapy is being given. Once the head has moved to a place that is central again and is happy, I then want to make sure that other qigong treatment that can help with stress and anxiety is now being performed. I've got one hand on her frontal bone and the other very lightly on the bridge of her nose. I've just got two fingers, my thumb and index finger, touching across the top of her nose. Mirka is very deeply relaxed by this stage, and what this type of technique will do is it helps with respiratory, sinus, headache, clarity, vision, and sleep. By clearing congestion, and not just physical congestion of the sinuses, but also mental congestion, mental inflammation. By clearing these areas, it really helps us to see life more clearly and feel lighter and fresher. This is a beautiful last treatment that I'm doing within her qigong cranial balancing work. I've got an index finger of each hand, one on her cheek, one on her frontal bone, the forehead, and then my thumbs on the frontal bone and the other cheek. And what can happen here, this technique is actually, we call it the jam jar treatment, is sometimes the cranial bones can feel stuck as if the top and the bottom of the cranium are working as one. But in actual fact, as we know when we breathe and our craniums inflate and deflate, each bone needs to work on its own accord, loose and soft. And I'm making sure that there is nothing stuck or too tight in this area. This really helps with stress. And now I slowly bring Mirka round. She will be so deeply relaxed. I ask her to take 3 deep breaths and then slowly move into her fingers, her soles, stretch her toes away, move into her shoulders by rotating one way and the other. And then working into the ankles. This stimulates the whole body. It reminds the brain of all the different parts of our body in that we can feel like each area is working as a team, as one. Now I'm asking her to breathe into her abdomen, her chest, and when she's ready, a nice long body stretch. This helps me too. It helps me to realign and stretch after being seated for a while and treating for a length of time. The last thing that we always do in core therapy is retest any tests that did not pass at the start of the treatment. I check my notes to see which areas need retesting. The first one is an IPSI test, which means one-sided. Oh, that's really good. I put a lot of pressure on them. That was so good. I'm testing the contralateral that did not pass earlier. Both were excellent passes, really strong. So that shows really good for her hips, for her walking gait and her joints. Now I'm testing into her hips using her right leg as a strong indicator muscle, an SIM. These are all really good. I'm putting a lot of pressure on them. If anything, I'm putting more pressure than I did at the start, just to show Mirka and her brain that there are some strong passes there, that she will feel so much better. Now I'm testing for the 3 areas which I tested at the end of the Anmofu, the deep abdominal massage, the 3 areas that were not happy earlier. A little bit weak there, but much better than earlier. So that was the ICV. Now we're testing the Houston valve, nice and strong. So the only one I'm still a little bit concerned with is the ICV, and I book an appointment with Mirka for a few days' time to treat again her ICV. So thank you so much for joining me. Really appreciate you subscribing and commenting. I'll see you again next week, where I will show you the next in my series of my latest therapies. Thanks for watching, guys.